Welcome to Magnolia Medical Minutes, your local source for medical advice direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is family medicine doctor, Dr. Brooks Pratt. Thanks for joining us today.
Thank you for having me.
I'm excited to talk about our subject of osteoporosis. So why is osteoporosis an important topic?
Osteoporosis is defined as low bone mineral density or bone mass. So this is a condition where bones become weakened and brittle. In the early stages, this condition is usually asymptomatic until a fracture occurs. Osteoporotic fractures can lead to significant pain, loss of height, change in posture, or abnormal curvature of the spine. Osteoporotic fractures in affected individuals can lead to significant issues with chronic pain, loss of independence, and reduced quality of life. Up to 20% of adults treated for a hip fracture will require long-term nursing home care.
Who should be screened for this condition?
Really, all women over the age of 65 should be screened for osteoporosis. Women below 65 who have certain risk factors, those who are underweight, those who smoke, those who consume excessive amounts of alcohol, or those with certain medical conditions should be screened. Really, men and women with a history of any fragility fractures, those with certain medical conditions, or those taking certain medications may also benefit from screening.
How is osteoporosis screening done?
Osteoporosis screening is done via a DEXA scan, which is a non-invasive test, which is really a special type of x-ray. This test will generate something called a T-score, which compares your bone density to that of a healthy young adult. Commonly, this number is reported along with your estimated fracture risk. Depending on these results, your medical provider may diagnose you with osteoporosis or osteopenia, which is considered the precursor to osteoporosis.
Let's say we found it. How do we treat the condition now?
General measures for those who have osteopenia and osteoporosis include adequate intake of calcium and vitamin D, a regular regimen of weight-bearing exercise for patients who are able to exercise. Those patients who smoke should stop smoking. Also, making sure that all measures are in place to prevent falls. For patients with a history of hip or vertebral fracture, those with osteoporosis or osteopenia with an elevated fracture risk, your medical provider may recommend additional medications to reduce fracture risk. A DEXA scan may be considered at a later date to assess treatment response.
Well, thanks again, Dr. Pratt, for your advice on osteoporosis and knowledge. Be sure to join us again next time on Magnolia Medical Minutes for your expert medical advice directly from the experts at MRHC here in Corinth.